Welcome to Lipstick and Lipo, your unfiltered guide to plastic surgery by two board-certified plastic surgeons. I'm Dr. Smita from New Jersey. I'm a board-certified plastic surgeon, and I'm joined by my friend,
Dr. Ashley Amalfi, and I'm a board-certified plastic surgeon in Rochester, New York. And we are here to talk about the magic word today, mommy
Mommy
makeover.
Makeovers.
So, everyone asks us, what does this word really mean? And the disclaimer is we didn't make this up, right, Smita? Like, this is
No.
not like a plastic surgery. Like, plastic surgeons didn't make this up. You guys all kind of came up with this term and,
Right.
social media, essentially. Right? I guess I
Yeah.
don't even know the exact
I
origin,
don't,
but
yeah, I don't know.
it's not a medical term.
It's not. I think it's one of those things like Botox and, all of these
Yeah.
like kitschy sort of things. But it sort of it caught on, obviously, because we commonly see it in moms. But it's a combination of procedures, essentially, right? We use this sort of big term, this umbrella term, mommy makeover, to talk about addressing changes that we see in our bodies after childbirth, breastfeeding, particularly relating to the breast and the abdomen.
Yeah.
Is that how you would sort of describe it too?
Yeah.
Mm-hmm.
It's really like anything a mom needs, and which, like you said, is usually a breast and body procedure, but
Mm-hmm.
it's so specific and personalized. So it's really tailored to you. What do you need? And for
Right.
every woman, that's really different. Some people have larger breasts or smaller breasts or saggier breasts, or everything sort of changes in a different way. Same for
Mm-hmm.
liposuction. A lot of patients add liposuction into their mommy makeover, but where they need it is so specific to your body type and that
Right.
genetic pattern and predisposition. So it doesn't mean it's not like it's a menu and you have to have all these things to get a mommy makeover. It really is whatever is specific to you to get you to whatever that goal is.
Right. Right. And I think that's what makes this procedure. I know it's one of my favorites, and I think it's one of your favorites also, Ashley.
Yes.
But it's so great because it's really specific to each patient. So you can have 5 people that come to see you in the morning for a consultation, and you're doing something different for each of those 5 people because our bodies, are unique to us, and they're beautiful in their own way. And there's different things that we might suggest based on your goals and wants to sort of address those concerns. So I think that it makes our day really fun and exciting and challenging and all of the above.
Yeah. A lot of people ask, does it make sense to do procedures as a combination, or is it more dangerous, or, should I space them out? But the reality is doing a mommy makeover is super safe. We are aware of just how much surgery we can do, how long we think it's safe for you to be under anesthesia, and to do that as an outpatient, which is mostly what we do. And so we would never offer you a combination of things that were not safe. And so we're going to be very, very cognizant of how much we're adding it and doing at once. And so, that's something that we'll be really honest with you about, and you shouldn't really be concerned about. Do you get people who worry about that a little bit?
A little bit, and I think oftentimes they sort of ask my opinion as to, what's better. Should I do my tummy first and then my breast, or do them combined? And ultimately, like you said, for me personally, I like to keep anesthesia under 6 hours, right? And I think we have a lot of evidence to show that for elective cosmetic procedures over 6 hours, you're starting to really, deal with some of the risks from anesthesia. But as long as I can sort of address both areas within that time frame, it is certainly a great option. So you have one recovery period, right? You just get your surgery once, you recover, during those 6 weeks, and you don't really have to think about it again. But sometimes people, financially or, for whatever reason, if one area concerns them more than the other, they might sort of choose that first, see how they do. And also, I think, I recently had a patient who wanted to do them both, but, for job reasons, she couldn't really take off the time that she needed to heal from a tummy tuck, from abdominoplasty. So she's choosing to do her breast first. And then when she's able to take the time off of work, she's going to come back for the tummy tuck. So it's a personal decision, but ultimately our job is to make sure that you are healthy and safe and we can kind of take it from there.
Yeah. So I mean, a lot of people want to know when should they have their mommy makeover. I think the first thing is, if we're going to really address both of these areas, you want to make sure you're done being a mommy,
Yeah.
or at least done having babies. You're
Having
still a
babies.
mommy kind of forever, but you want to make sure you're done with that process, because we're going to make things look as good as possible for your breast and your belly and whatever else. And we want to make sure that it stays that way. So we just want you at a stable weight, done having kids. So whenever you make that decision, I think that's a great time. And then I think the timing really is just the logistics for your family. Do you have a lot of help? Is it going to be easy to take care of the kids when they're little? I mean, some people I have, they're on my schedule when they're 1 year after delivery, because that's usually how long I make them wait, and they're like raring to go. And then some
Yeah.
people wait a couple of years to make sure they're done with their family, and things are a little bit easier at home.
Yeah. I
But
mean, yeah, I agree with you completely. I think the biggest decision, right, is to make sure you're not still having or growing your family, because,
yeah,
our results are going to be as stable as our bodies are. So, if our weight is fluctuating or we're sort of going through all the hormonal changes again, our results are going to change. That's not to say that you can't do that, but obviously that's not ideal. I typically
not
have
ideal.
patients wait at least 1 year from when they're sort of done breastfeeding, right? At that point, you sort of most people have returned to their pre-pregnancy weight, and their breasts have sort of returned to, it's not, all the changes that have happened from hormones have sort of resolved and normalized.
Yeah.
But I think the other important thing to keep in mind is too, for the first 6 weeks after surgery, 4 to 6 weeks, we usually have restrictions as far as the activity that you can do. So lifting more than 10 or 15 pounds. So if you have that 1 or 2 year old that you're having to carry around, then, that's certainly something that you should consider, either having help or waiting until they're older when they're not sort of relying on you to carry them.
Yeah. Exactly. You're calling in all the favors, all the parents, all the in-laws, all the babysitters, every girlfriend who wants to help. You're putting them on duty if the kids are little, but plenty of people do it. And it's, as long as you plan, you absolutely can do it when their kids are little.
Right.
Yeah, it's you're going to feel so good afterwards that you're going to be, you're going to be able to be there for your family and take care of them when you feel really good about yourself. And so there's no time that's really the right time, and there's no combination of procedures that's right. It's just really what's right for you and what works for you and your family. And that's what's so cool about these, is that they're just so tailored to, getting you back to wherever it is that you want to be.
Right. And you bring up a good point. They are very tailored and very specific to sort of you and your goals are and what your goals are. So sort of, just briefly, sort of what you mentioned before, right? Some patients might have bigger breasts, smaller breasts, saggier breasts, right? So, there's different options we can offer, like a breast reduction, a breast lift with an implant, or a lift with fat grafting. Definitely different options for the breast, and then for the tummy too. If it's just a little stubborn fat, you can just do liposuction. You can combine that with different skin tightening modalities like Renuvion or, Body Tight. Or you might need a tummy tuck or a mini tummy tuck, so it's very, there's just a plethora of different combinations we can do. It's endless, but it's, at the end of the day, it's tailored to sort of what your body looks like, and what your goals are.
Yeah, absolutely. And so, mommy makeover is a great thing if you're looking to kind of restore your body, get it back to where it was before having kids. No matter what those like very specific concerns are, we'll make a plan to address all of those. And that's why these consults are so fun for us, because we get to meet you, we get to talk about where you are, where you used to be, where you want to be, and we can talk about what we can do safely in a combination procedure, usually, to just get you back to whatever it is that you want to be.
Yeah, I mean, and I think the patients are like, everyone's just so happy afterwards, right? Which I think is so amazing. Is, this is the first time after many years, I think, that moms are finally doing something for themselves. So it's just, it's super rewarding for us to see, to see that kind of transformation as well.
Yeah, it's really, really great. So we're excited for you. We're excited. We'll have much more on mommy makeovers. We'll go into things in depth, but now you know what it is. And you've heard it from two board certified plastic surgeons. So unfiltered plastic surgery information right here for you. So you guys have to subscribe to Lipstick and Lipo on YouTube so you can hear more. We're so excited to have you here.
Looking forward to more episodes. See you guys soon.
Thanks, guys.